Welcome to one more edition of Three Things Thursday. And today I have Catherine with me. So this is our last one for the month of January. In January, as you know, we've been talking about transition to adult healthcare. And so this is one of the last pieces that we had talked about. So let me share my PowerPoint. All right, so we're talking about, today we're going to talk about the concept of medical home. I know some of you, this might be something new, something that you might not have heard of before. So we're going to talk about medical home, and then what does a medical home mean as you're transitioning to adult healthcare? So Catherine is going to talk to us about what is a medical home, and then she's going to briefly talk about some of the components, what constitutes a medical home, and then also talk about health transition and medical home. What's the connection between those two? And then I will share some resources and like a tip sheet. And on Facebook, we have the link for the tip sheet. So Parent of Parent of Georgia, along with Children's Medical Services, put together a tip sheet about medical home. So you can look at that, because actually Children's Medical Services, which is a program from the Department of Public Health, they actually do care coordination. That's part of it, and transition is a big part of what they do. We worked with them together to put together that tip sheet on medical home, and then I'll also share a website. So Catherine, take it away.
So what is a medical home? It's not a physical place or a building. It's not an actual home in the sense of a structure. It's a new way of thinking about healthcare, and it's really like a home base more than anything. And it's a new approach to providing comprehensive primary care. Its aim is to make things more timely, effective, appropriate, and it's really it's how your child receives medical care. The medical home's role is going to be similar to the transition team that's in place when your child's turning 18, because it's kind of it's a team of people. So it's a team approach, and it's going to include the doctors, the therapists, the rehabilitation professionals, and any kind of specialists that you're are seeing your child. And especially in the case of a child with complex medical needs, many of you know that this is going to be quite a varied team. And sometimes it's a lot of, well, any mom of a medically complex child knows it's a lot of work to coordinate and keep the lines of communication open amongst all of those different team members. An important aspect of it is that it's family-centered. So sorry, I'm maybe a little behind on the slides, but family-centered care is kind of a concept that's become popular in the last 20, 30 years, where it's used to really just be the doctor directed the care. And now it's the gold standard model is really where the family is an equal participant in the decision making. And so family-centered care is a huge, huge component of the medical home model. It's meant to help the parents feel supported. It means that the doctor's providing helpful information to not just the family, but other members of the care team. And it's making sure you understand the treatment choices that your child is, being offered. So the components of medical home, there's like 6 pillars of it: accessible, continuous, comprehensive, coordinated, compassionate, and culturally effective. So, to be accessible, part of family-centered care is being able to get through to the doctor and being able to reach them when they're or reach somebody when they're maybe on vacation or not on call. And that's part of good patient experience, is not just, is the doctor good, is the front desk good, is the front, and that's all part of what a medical home aims to solve for. It should be ongoing. You're not supposed to have gaps in care. So continuous is an important part of it, because we all know, that's not good for a child to have a gap in care, particularly with a fragile medical situation. You can't, that's absolutely unacceptable. But even a gap in therapy can be disruptive and harmful. And And it's, really supposed to be coordinated so everyone can work together, and compassionate and culturally effective are two huge important pillars of family-centered care and good patient experience. You want to have things communicated to you in a way that you can emotionally manage. We all know how many people on this call, I'm sure, have had situations where things have been communicated to you and you hear 10% of it because it's so traumatic to absorb everything that's being said to you. So you want to have it communicated in a way that's allows you to, as a parent, to absorb as much as possible of the information, and to be culturally effective and being appreciative of certain cultural mores around different groups, where maybe a group is maybe the extended family is particularly involved in certain cultures, and to be cognizant, or maybe how families live in there's combined families, multiple families living in a home. I mean, my family, we had that for many years, grandparents living with families, and being cognizant of that and how that affects the health care of the child and the care of the child. So health transition and medical home is, this is where transition is really a time when medical home really can become a great tool for families. As you move from pediatric to adult care, there's a lot of coordination, it's a lot of work moving people from maybe pediatric neurologists to adult neurologists, moving away from a pediatrician that you've had a 22-year relationship with to a new PCP who has an understanding of your child's complex needs and disability. And, if you have a good medical home, if you have a medical home and a good situation with your pediatrician can help, develop a plan of care to help with that transition and help figure out who's going to be on the transition team and who's going to be on the new team. Medical records are a huge part of that. Finding out is there a centralized database where all of these records have been maintained so that's easily accessible by future providers. And, also to help with referrals to the new professionals as well. So in Georgia, the medical home concept is in its infancy. I have talked to colleagues and friends in other parts of the state or other parts of the country where there are more medical homes and it's more of a familiar concept. But I think that we hopefully we'll continue to see this concept grow as patient experience and the whole economy of Georgia healthcare is competitive. And so hopefully, providers will embrace this model, which can be a really great one for families of kids with disabilities and other healthcare needs.
Yeah, so I wanted to share these two resources. Thanks, Catherine, for that. As she said, like medical home, it's still not, many of you may not have heard it, and it's still not that popular a concept. But it definitely, the American Academy of Pediatrics and all these big entities, the medical entities, they've all embraced this medical home kind of approach to helping families, especially of children or young adults, or even elderly. We all know, our parents or our grandparents, who are having multiple or chronic care issues, medical issues, having a medical home really helps prevent, actually it helps helps the person have a healthier lifestyle. And so that's why it's really critical. So anyway, I'll show you. So we do have the tip sheet. The tip sheet has lots of information. So I would definitely urge you to ask questions to your doctor. Although, you may not have a quote unquote, like a medical home per se, but you might want to talk to your pediatrician or your primary care. And maybe they're serving in that role. It's just that they don't call themselves that medical home. So let me just stop sharing and then I'll show you the National Resource Center. And that's actually housed under the American Academy of Pediatrics. It's under their website. So 1 second, let me just do that.
I mean, we're in the process of changing a specialist for my son, and it's been super complicated managing the records. And he's had, seen several of this kinds of specialists as we've moved around. And my pediatrician has just been amazing with being kind of like, our safety net during that transition process with medication and helping us find a new person. And so I can attest to why this is, something I would love to see for my family.
Absolutely. So here is, so this is the National Resource Center for Patient and Family-Centered Medical Home. That's what they're calling it now. It used to be called as the National Center for Medical Home Implementation. So I just picked there's a whole under tools and resources, there's a whole section for families and caregivers. And I thought this was really cool. So it talks about building your care notebook, and it has all these all these resources that you could kind of look at and see. And I've shared this before, I have like a 1-page kind of summary, depending on which doctor I'm going to see, so that all my son's current medical conditions, some little bit about the history, and then what medication he's taking right now, all the doctors that he's currently seeing, all that I have on 1 page. And it really helps, I mean, this care notebook that you put together, it does not have to be something that's a 3-ring binder with, piles and piles of information, because trying to keep it updated can be complicated. But, you could do something. Mine is just on my computer, and I just go in there and update it constantly whenever I want it. And I actually email it to myself so that I have it in email, because if I'm somewhere outside, I can't get into my documents on my computer, but I have it on an email. And so I can open that and, show it to whoever. It was also really neat once when we were traveling, back in those days. It feels like a long time ago. But when we were traveling, 1 year, we went on a family vacation, but my son remained here, and he was, we had caregivers and we had other staff who were taking care of him, but I had to make sure that all his medical information was current, and all the emergency people that needed, people who were my backup, who needed, if there was an emergency, that they could come. All they needed to know what was going on in, all the details about my son. And it was really easy to put together because I already had all this information at my fingertips, because I constantly update them. You can give it to people in summer camps, that kind of stuff. But so anyway, this gives you some, some ideas on how to keep, like this appointments. I mean, I have a Google Calendar. That's how I keep track of my appointments. And so I just think that this has a whole chock full of information. There's some videos, even on the Parent of Georgia, on our website, we have some videos that some of our staff did about medical homes. So I just wanted to show you, some information and some tools and some resources that, that is available online. And then we also have that tip sheet. One second, I'm just gonna, so I just wanted to share, this with all of you, and definitely look at it, something to look for. So again, as always, thank you so much for listening. And I just want to share, so for me, in our situation, our pediatrician acts as our medical home. So my son sees, at least 4 or 5 specialists. And one of the good things about everything being electronic, the minute the specialist sees my son, they dictate notes, or they have the office visit notes. And so my son's pediatrician, she makes sure that she gets all these notes from all the doctors. So it is in a centralized place. So if I need it for something, say I'm filling out some kind of form and they ask me for some kind of information, I can always, I can go to that specialist's office and ask for it, but I know that I can always go to my pediatrician because she has all that documentation in electronic format. So she acts as our medical home. And right now, with my son being 19, we are working through the transition process. And so she's been making referrals, and then we'll definitely talk about having a care plan ready so that when he transitions. And the other thing is records, right? I mean, all the records. I think nowadays, I mean, there's all, like CHOA has the MyChart through which you can communicate through the doctors. I know Emory has, the Emory portal that you can talk to doctors. So, I know that at least for my son, I'm using 3 different portals to communicate to doctors on 3 different systems. So it is a lot to keep track of, but, just making sure that you have everything together and asking your doctor for that help and support is what the medical home is for. So anyway, thank you so much for listening. And that's our number. If you need more information, feel free to call us. And I wanted to share, anything else? Catherine, did you have to say?
No, I love my pediatrician is the bomb too. We're lucky to have such.
Yeah. And so, like I said, they may not say that they're the medical home, but that's kind of what they're doing. They're helping with care coordination. They're helping with comprehensive care. They're making sure that there's no gap in services. They're making sure they're preparing the family for those transitions. So that's what a medical home should do. So anyway, and I'm excited. So that kind of concludes our transition to adult healthcare, the little snippets that we did this month. Transition, like anything else, is a process. It's not an event. It does not happen in one day. So what we shared with you is just short little nuggets of information that we hope will be helpful. And I'm super excited for the month of February and March. We are doing a whole series on everything that you would want to know about behavior or handling challenging behaviors. And also want to say it's not me talking, and I am getting some experts. We have Amber Brown, who is a BCBA, who will be coming on to talk to you not next week, but the week after. She's going to talk to us about what are the functions of behavior, what is an FBA, what is a BIP. So I think that will be really some great information. So if that's something of interest to you, make sure that you log on at 10:30 on Thursdays for that, or you can always watch our recording. Anything, Catherine?
No, I think I'm excited to listen to those. I think that will be super helpful to get that perspective.
Awesome. Thank you so much, everybody. And we'll see you as always next week.